Hello, Professor Shuba. Welcome to my exercise progression project. This is my brother Hassan, who's going to be playing my patient. And my project is frozen shoulder, also called adhesive capsulitis. As the name implies, there is adhesion in the capsule, the shoulder joint. What usually it happens to people aged between 40 and 60. Commonly more in women than men. Still, doctors are not sure what's causing it, but some suggest trauma or after surgery. Some diabetic patients can be also prone to get frozen shoulder. Usually it goes through 3 phases: freezing, frozen, then thawing. Usually it takes between months up to 3 years. Sometimes it resolves by itself. Doctor says usually physical therapy is enough and good to resolve the issue. So with this one, I'm going to start from passive range of motion and go along with stretching, then going to assistive active range of motion, then to active resistive range of motion. So with this one, I'm gonna have my brother to pretend that his right shoulder is the frozen one. Okay, after introduction and the whole thing, I'm just gonna tell him, okay, Mr. Sam, my name is Sam, I'm gonna be your student physical therapy assistant. I read your chart and now you have frozen shoulder on your right. How's your pain level?
It's like 3 out of 10.
3 out of 10?
Mm-hmm.
Okay. So now, I can see you're active, you're gym goer as well. Okay, so we want to get you there. So what we're gonna start with, we're gonna do some exercises. First, I'm gonna test your range of motion, how much you can move your arm. With this one, I want you to relax and let me do the exercise. So I'm gonna be coming here. So I'll test with flexion and extension and internal rotation, external rotation. Usually the internal and external rotation is usually the more pain. So we're going up. So how does that feel?
It's a little bit like, now it's pinching.
Pinching? Okay. So we stop here and we go down.
Yes.
Yes? Let's go this way. Move this up, and how does that feel?
Yes, started now.
Start now? Okay. Okay, and now do that. Move this way. How does that feel?
It's good.
Yeah? How does that feel now?
A little bit.
More?
Yes.
Okay, so it's more with external rotation than internal rotation. So we do that, except, however, we can move to stretching. Stretching is very good to, to open up that capsule. So Mr. Stan, I'll have you first stretching what we call pendulum. I want you to come over here. I'll show you first. Put your good hand here and let the gravity take your hand, your right hand, and I want you to draw circles.
Okay.
With this one, I want you to draw slowly 10 circles. This will help open up your capsule on your shoulder.
Sure.
Okay.
So this way.
Okay.
Just let it drop.
Let it drop and draw circles. 10 circles. 1. And count with me.
3, 4, 5, 6, 7, 8, 9, and 10.
How does that feel?
It's good.
You can also move your hand side to side.
Side to side like this.
Like this way, yes, and this way.
Okay.
Like a cross.
Okay.
Also 10 times. 1, 2. Count with me so you don't forget to breathe.
4, 5, 6, 7, 8, 9, and 10.
And the other side, yes.
This one is a little bit.
This bit more?
Yes.
Okay.
4, 5.
You can stop if it feels too much pain.
Yeah, okay, 7. So that range is good.
Yeah, that's good. Okay.
9,
10. Okay. So this one you can do it. I want you to do it 5 times a day.
5 Okay.
Every like movement 10 times.
10 times. Okay.
Okay, so 5 by 10.
5 by 10. Okay.
All right, and we'll give him at the end, of course, a program. So this first one. The second one I want you to do, it's going to be harder, but it's very important. I'm going to use a belt. With your hand, I want you to take this one.
Mm-hmm.
With the, go, yeah, throw your
Behind.
Behind.
Okay.
Okay, I think this way is better. Take this one.
Okay.
Don't move this. Let your good hand pull your hand, the other hand up.
Without any resistance.
No, without resistance. Just try to pull it so you can feel stretch a little bit.
Okay.
Right. Okay, and hold for count to 5. 1,
2, 3, 4, and 5.
5 and release. How's that feel?
It's good.
It's good.
Mm-hmm.
We can repeat it one more time.
1, 2, 3, 4, and 5.
Okay. So this one we do also and can release. Now we do also that. I want you 5 times a day.
Mm-hmm.
Also count to
5
5
every time
and release.
Okay.
Okay.
Mm-hmm.
And now other stretching which I found useful. I'm coming close to the camera. I'll get the ball.
Okay.
I'll show you how. You can get to the ground, right? Because in this scenario, the patients only have frozen shoulder. He's active. He's strong in his lower extremities, so has no problem. I'll show you how. So we get to the ground.
Mm-hmm.
I want you to place your arms parallel that way with palms facing each other.
Mm-hmm.
Then stretching slowly this way to the best. I mean, to the best of your ability. You don't have to go all the way. Whenever you feel
my feet on ground.
And keep your feet on ground and sitting that way, and stop whenever you feel pain.
Okay.
And try to hold it for we'll start with 15 seconds.
Hold it for 15.
Hold it for 15 seconds because the purpose of it is to stretch
Makes sense.
those shoulders. Yeah,
Sure. So
start, okay, with arms both parallel to each other.
Mm-hmm.
Now, try to move the ball away from you and stop whenever you feel pain.
Like this.
Okay, is that good?
That's good.
Now try hold it for 15 seconds and don't forget to breathe. I'll count for you. 1. I'll pretend this is 15 seconds. Okay.
Okay.
Okay, now, how does that feel?
It's good. It's that stretch is good.
That stretch good.
Mm-hmm.
Also, you can repeat 5 times. So every stretching, now I showed you 5 times. And hold it, this one 15 seconds. Once you feel comfortable, make it 20 seconds.
Okay.
And then from 20, go to 30 seconds.
Okay.
30 seconds. So after stretching, we get this movement better. We'll start with active assisted range of motion. So what we do, we're going to use a cane.
Okay.
I'll show you
Stand
how.
up?
Yes, you can come in. You can stand.
Okay.
So we're going to do different motions. You can hold it like this,
Mm-hmm.
either way,
Mm-hmm.
and move it up
Oh, I see. Okay.
till whatever you can feel.
Okay.
Okay, we go down.
Mm-hmm.
This is the first one. I'll show you then how we do it.
Okay.
Okay.
And keep my arms like extended.
Yes. Move it up and stop whenever you feel there is like a pinching or pain.
Yes, that's it.
Okay, and then move down. Okay. Don't forget to breathe in. Do that. Can you do that 7 times?
Okay.
Okay, that's 2. That's 3. That's 4. Five, 6, and 7. How's that feel?
It's good.
Good? Okay. So because we wanted to go different directions, so we target different muscles of your shoulders. Also with the cane, I want you to go side to side. But however, your right arm, I want your elbow to be tucked in.
Tucked in. Okay, I see.
See this way? And
Oh,
let your left arm push your arms away and take it here.
Okay.
All right. Also 7 times.
Okay.
For demonstration, we're going to do it 3 times, but pretend this is the 7 times.
Like this?
Okay. Let me see. More tucked in. Sorry, this tucked in.
Okay.
Oh yeah, he has large muscles. Okay. So
yeah,
1.
That's where it stops.
Yes. So we're targeting internal rotation and external rotation with this one. That's how much you can do now?
That's
okay.
Without pain.
Without pain, yes. So also 7 times. We'll pretend this happens 7 times. Also, we're going to do another one. So we do this way. I'll bring it this one.
So the tucked in.
Yes. Well, it doesn't have to. No, it's not necessarily tucked in. But your left arm forward, and this one the back, your right, and move it in the back.
I see.
So extend it all the way back.
Okay. All the way.
So your elbows moving behind you.
Sure. I see.
Okay. Also do it 7 times.
Okay. It's just like this.
Okay.
Yes.
How does that feel?
It's good.
Okay. So now we're targeting also the extension, hyperextension. So we did flexion, extension, hyperextension, internal and external rotation. And 7 times. And that you do 3 times a day, 3 by 7. 7 reps.
3 by 7, okay.
Each movement.
Each movement.
Okay? And once you feel comfortable, we take that increase more. So that will be 3 by 10.
Okay.
Okay. So this is active assisted range of motion exercises. Now we progress from there to active resistive range of motion. And I have a couple of things that he can use. I'm going to use first the resistance band, this one. So Sam, let's come here. We can do it while you're sitting. I'll show you.
Okay.
This one also is important that to strengthen your shoulders.
Okay.
So with this one, you step on both this band. Your thumbs up. See where you're going? That way. And move your arms, and you feel your shoulder blades are retracted. What that is, imagine if you have like an apple between your shoulder blades, and you try to squeeze them. However, see my shoulders. Keep your shoulders lowered. Don't do that.
Okay, don't shrug.
Don't shrug. So keep your shoulders down, with arms up, thumbs up, and move. Yeah. Okay. You feel that stretch.
Okay.
So now try this.
Okay.
Step on both of them.
Okay. So I said arms like this.
Yes, and
shoulders
thumbs
down.
Thumbs, yes, that direction. Shoulders down.
Oh yes.
You feel it?
Yes.
Yeah. All right. Do this also 7 times. Try to, with your arms, that way.
Like this way?
Yes.
Oh, it changes the angle, okay.
It changes the angle, yeah. 6, 7. Okay, so also 3 times a day.
3 times a day?
7.
7.
And that's one thing. The other thing we can move right as he progresses, we can use also this as weight. This one 3 pounds. I'm pretty sure he can hold more, but we'll start with 3 pounds. So with this one, we can do different things. You can do it standing or sitting, it's fine. Hold this, way. Move it
towards me,
towards you, and away from you.
Oh yes, okay.
Towards you,
makes sense.
And away from you.
Sure.
And then you do up.
Like raise?
Yeah, up to the sky. And move down.
Okay.
When we move down, you can move your elbow back like this.
Okay.
Up, down.
I see.
So you have 2 exercises. Let me repeat it. move your keep your elbow bent like a right angle, and hold it that way. Move it close to your
chest,
like your chest, away from your chest. Then
all the way
up to the sky, and when you go down, go all the way.
Okay. Okay, makes sense. So
Tucked in. Tucked in.
Close to my chest. Away from my chest.
Yes.
Close to my chest.
Yeah, you feel those muscles are contracting. Also 7 times. All right. Okay, now you can move up all the way
up to the sky.
All the sky. So reaching the sky.
Yeah, that's it.
Yeah, and all the way down and back. Yes. Way up. All the way down. Okay, and the last one I showed you with this one, you can we wait for target abduction. Thumbs up as much as you can.
Okay.
So for me, I can do it all the way up and back.
I see.
All the way up.
Also. So.
Okay.
Yes. Thumbs up like this.
Yes.
All the way up.
Yeah. Because this way you get more motion. Yeah.
Okay. I can stop here.
Yes. Okay. Also 7 times. So every set I give 3 sets of 7 reps, and we can go up from there and increase the weight as the patient progress and the pain subsides and return back to normal. And that's our project. Thank you.
Thank you.